Welcome to Evergreen Family Medicine. Today we are with Pam Anderson, who is a DO at Evergreen Family Medicine and Evergreen Women's Health. Welcome.
Thank you. Thank you for having me.
Sure. This is the first time we've had a chance to talk, so why don't you give us a little bit about your background and maybe how you ended up at Evergreen?
I am originally from Oregon. I was born in Eugene area and spent most of my life in Oregon, except for going away for college in Washington. But I came back and then worked a little bit before going the medical school route and did medical school in Lebanon, Oregon, and then off to Idaho for residency training. And I'm so excited to be back. Almost a year and a half now I've been with Evergreen working here, and it's been a very good fit for me and my family, and then also my career goals too.
Terrific. Well, we know you have a role in both family practice, primary care, and women's health. So talk a little bit about maybe what a typical day is like for you.
I will often, at least 2 days a week, be mostly focused on women's health in my clinic role. I'm also on call for women's health, usually at least like 1 day a week and 1 week in a month. But so we could be focusing on preventative screenings for their visits. We could be talking about a lot of concerns around periods and other things that might come up around birth control too. Just trying to have reach their health goals, whatever that might be, in their visits. And sometimes we're doing prenatal care and taking care of them for their pregnancy, or I'm seeing other colleagues for their pregnancy, and they come to see me as well. Just because sometimes things happen in the middle of the night, we run in and don't want to be a stranger to them. So on the Women's Health Days, it can be a wide variety of things along those subjects. Often we'll try and squeeze in, if I'm taking care of their newborn too, and say I've done their delivery, we'll coordinate a bit to see if we can do the postpartum visit for the mom, and then also check in on baby to see how they're growing, feeding, peeing and pooping, all of that good stuff. So that's my focus on maybe my Women's Health Days.
Sure.
Yeah. On the family practice days, that could be, again, quite a bit of variety. Still, I might be taking care of kiddos, or might be taking care of some of my 90-year-old patients, and making sure that they don't, like the 90-year-old guy doesn't get in too much trouble from their wife or sneaking ice cream at night. That does come up, and they will often tell on each other, and I love that part about it. And you know, it's just, I have families, whole families that I will see. So we'll see the baby, and then we'll see mom, we'll see dad, and grandparents. It is why I went into family medicine, and then also to have that women's health focus means I can take care of that stage of life too. So it's very exciting, but challenging. I'm always studying.
Earlier, you said something about and your career goals as well when you came to Evergreen. Let's talk about that just a little bit. What were you referring to there?
When I was in medical school, I really enjoyed kind of everything, and I could not decide what specialty. However, I felt really challenged by family medicine because I knew of that you have to kind of know a little bit of everything. And I wasn't sure I was up to that. And I really didn't want to miss a diagnosis. I wanted to take very good care of my patients, well-rounded, on not just say things pertaining to like a joint, a shoulder joint being sore. I wanted to make sure I could cover if their kidneys started having, showing signs of failure. So I went for family medicine, and I chose some place that would do a well-rounded experience. So I was in a rural hospital. We had the run of the hospital, and I would respond to things in the ER, whether it was like a serious, very significant car accident, or a baby was delivered and needed help because they weren't breathing well. We were just always on the go when we were working, and it provided a really good background where I thought, okay, I think potentially I can do this. I can take care of everybody. Roseburg seemed to be kind of maybe a good spot for me to fit into, is through those patients teaching me things, hopefully I can connect a little bit here too, even though I'm from Eugene area.
So that rural feel is something that became important to you.
Yes, yeah. I have a specific scholarship to work in a rural area after residency, so I was committed to that, but it does fit my personality. I like kind of running into people out and about. I like that idea that I know the whole family and that I might see them at the grocery store or say at a rodeo or say at the farmer's market, things like that.
Well, it's been good to get to know you. Thank you for your time.
Thank you.
That's Pam Anderson, DO here at Evergreen Family Medicine and Evergreen Women's Health. You can learn more about all of the providers at Evergreen at evergreenfamilymedicine.com. And you can follow Evergreen on Facebook, YouTube, Instagram, and Twitter.